First Medical, this is Life Support Unit 737. Request that you notify your brain attack team that we have a 68-year-old male victim, cold stroke, en route to your location. ETA is 10 minutes, over.
Roger, 737 will notify. Do you have more, over?
Roger, subject is approximately 90 kilograms.
Stroke is a time-sensitive emergency. The opportunity to reverse or minimize neurologic disability is dependent upon a rapid response. And that response begins prior to arrival at the emergency room, with early recognition of the signs and symptoms of stroke on the part of community members and first responders.
Subject is positive for facial droop, pronator arm drift, and slurred speech.
Many first responders rely on the Cincinnati Pre-Hospital Stroke Scale, which suggests evaluation of facial droop, arm drift, speech, and time of symptom onset, or FAST. If any of these signs or symptoms are present, suspect that the patient may have suffered a stroke. Pre-hospital management of a stroke is critical because outcomes may be determined by actions taken prior to arrival at the hospital. Emergency personnel should consider the following steps when dealing with a potential stroke. On scene, manage airway, breathing, and circulation, and perform a pre-hospital stroke assessment. Establish and record the exact time when the patient was last seen normal. Since stroke is an emergency, rapidly transport the patient to the closest appropriate facility capable of treating stroke. If possible, bring a witness or family member, or obtain contact information such as a cell phone number, and alert the receiving emergency department. Also, record the patient's blood pressure and blood glucose level to assess for hypoglycemia, which can mimic stroke. Establish cardiac monitoring and intravenous access if possible. The importance of reliably determining the time of onset of stroke symptoms cannot be overemphasized. Time is brain.